Hello, I hope this finds each of you well. I wanted to make a video to help you this week. I looked around for appropriate YouTube videos to help us with this week's topics, and I couldn't necessarily find one, and so I'm going to share a couple of them. And if you have time, you're welcome to go ahead and watch them. I would encourage you to watch the first one that I share. If you have time to watch the second one, I think it would help you become a little more deeply aware of the issue, immerse yourself in the issue a little bit more. So I do recommend both of them along with this video to help, and taking time to read chapters 10 and 11 in the textbook. I will tell you that originally we were going to talk about multicultural issues. In thinking about this, I feel like with the adverse childhood experiences study, because trauma affects each one of us, each culture may be more inclined or have proclivities toward certain kinds of trauma over another, what we may subject our children to. Regardless of that, the impacts on humans, on people, are very similar in that it causes hypervigilance and the host of other issues that we've talked about in the slideshow. So thinking about adverse childhood experiences and how they relate to multicultural issues, I believe that they cut across cultures, because we're all similar. We all experience pain, and pain may manifest itself in different ways, but it does tend to cause some dysfunction. So across cultures, regardless. So be thinking about that as a multicultural wellness. I will also tell you this as far as multicultural issues go. Never assume that you know someone's experience. So one of the worst things that we can do if we're looking at multicultural issues is to come to the table and assume that we know somebody else's experience, that we can truly put ourselves in their shoes. What we should be doing is acknowledging that we don't know and be asking questions, regardless of how somebody may resemble maybe a stereotype or something that we've had in our minds that represents this particular cultural group. Regardless of that, we need to ask that individual about their own experiences and not assume that we know. That's where we get in trouble as counselors. That's where we get in trouble as people, when we assume that we know what other people have experienced, and that in a way discounts that situation. In the United States, we're a cultural melting pot, and so each one, and regardless of that situation around the world, each one of us represents, with our own unique set of circumstances, our own unique set of experiences, and our own unique cultures. So it is important that you ask people, to say, hey, I don't understand, and just acknowledge, just come to the table and, hey, I don't know, could you tell me more? I want to learn. That is how we get closer as a people, and that is how we acknowledge and respect multicultural issues. So, and diversity issues for that matter. So that is my 2 cents. We don't have a lot of time to immerse ourselves in that, but be aware, and you're welcome to kind of look through our text. Okay, so on to the topic that I actually chose for us to take a look at to kind of help us through this multicultural lens. And I chose it purposely because many times people who are in domestically abusive situations may become dependent, and not all in a pattern that's chosen by themselves. After a while, that pattern can become chosen for them. In other words, they become trapped. So the 2 videos that I shared, the TED Talk and the YouTube video, please pay attention to them because they'll help you work your way through this. And so I will say that I'm going to start talking about the folks that become abused in domestically violent situations. More times than not, those happen to be women. More times than not, domestic abusers tend to be men, and the statistics are overwhelmingly see and state that men, I believe it's 85%, are perpetrators of domestic abuse. So abuse can take several forms. Abuse can take an emotional, spiritual, verbal, physical, of course, sexual, and there are several different types of abuses. One of the best way to kind of understand this is through the power and control wheel, and I will share that on Blackboard accompanying this video, so you'll find that as a resource. But the power and control wheel really views domestic abuse through the eyes of power and control. In other words, it's this need to dominate, this need for assertiveness. And so when you're working with people who are victims of domestic abuse, oftentimes it is very similar. It is very similar to working with people who have an addiction. Now, I'm not going to put that on a one-to-one sort of relationship. People who are in domestically violent situations have somebody who is exerting power and control over them, an outside sort of entity. So you might think, well, that's kind of like an addiction. A drug can exert power and control over a person, but it's not the same. It's not the same sort of situation, and so we shouldn't make a false equivalency, although there are parallels. So that being said, I'm going to switch gears and not talk so much about the people who are victims, because that's often our place as counselors, is to try to help the victims out of an abusive situation. But I'm going to focus more on where we need to focus as a society, as a people, because we often put the accountability on the victim. It's your choice to stay. It's your choice to leave or not. It's your choice to report, and that puts a lot of extra burden that person is already experiencing on the victim. Where the pressure needs to be applied as a society, as a group, and even as counselors, the pressure needs to be applied to those who perpetrate violence and abuse against their victims. That is where the accountability needs to lie. One of the things that is common for perpetrators of domestic violence that actually get accused and go to court and actually proven that they're domestically violent. So one of the things that is often suggested from courts, from counselors, is a 52-week Batterers Program. Now, so you go once a week, twice a week to this Batterers Program, and you participate in group counseling, and it's this intensive group process. The problem with the 52-week Batterers Program is that across the United States, recidivism rates actually increase after people go through the Batterers Program. And so you can look at that, and try to say, well, why does that happen? And maybe many times people go and you have kind of birds of a feather and people learn from one another. But that's a problem. So we need to kind of rethink, what are we doing? What are we doing as in treating people who perpetrate crimes against people that are really built on, and if you look at the abusers themselves, they fit a profile. Many of them, you say, well, don't profile people, but oftentimes, and I will say this by and large, this has been my experience in working with hundreds of situations where, at least in the Enid community, where there have been domestically violent situations, they exert a need for power and control. What this is a deeply seated insecurity in the perpetrator. In other words, the perpetrator is very vulnerable at their soul. And the reaction formation, the opposite of that, is this hard, pompous exterior that, and oftentimes charming, often very manipulative. That's one of the key words I'll use for the abusers. Very manipulative, emotionally. You go around that power and control wheel, and you can see the levels of manipulation that abusers exert on their victims. But the one thing that I've noticed, and I've seen tens and tens, hundreds of psychological evaluations of people who have been convicted of domestic violence. And the one commonality that I see coming through there overall is a narcissistic personality disorder. And so you think about, well, what's the root of a personality disorder? Usually the roots of those are very early in life, a childhood trauma, an insecurity, someone didn't acknowledge, somebody didn't give attention, for whatever, maybe there's a separation. For whatever reason, maybe a parent had a mental disability that they're working through, a mental condition they're working through. But whatever happens, there is a deeply seated insecurity within the narcissist. In other words, there's this reaction that then all of a sudden comes out that says, and I think it probably becomes a survival mechanism early on and through time, that I am better than others, that I deserve this, I'm entitled to this, other people are less than me, I need to associate with people, and really people want to be like me. I need to associate with people that are higher up. I can't really associate with lower level people. I am entitled to treat others poorly because I am better than them. And that is really at the heart. And so you talk about things like male privilege. It can be spiritually reinforced. There are a lot of fundamentalist religions around the world that really extol the virtues of masculinity, and I think we see that embedded in our scriptures, in our that are from these very patriarchal societies, written a long time ago. But we do experience this on many multiple levels, and so over time, you can see that the person that's abusing may find refuge in the church or find support. Well, you can't get a divorce because the scripture, says against that, or the male is the head of the household, this and that. So it is not built on equality. And one of the things that I believe both the abuser and the abused confuse this power and control with is love. And if you start to discern and look at that power and control wheel and look at the things, it's not a love. It's a need for power and control. It's a need for domination. It's a lack of security in letting that other person become their own person. Oftentimes abusers isolate their victims. Oftentimes they, make them think they're crazy. They continually put them down. They shrink the abused person's self-esteem by, putting themselves up on this pedestal. And so it's difficult systematically to address many times, but without acknowledging all the multiple factors that go into the abuser's mindset. And so, you're thinking, well, what can you do? What can be done to really address this kind of personality type of flaw in the abuser? And so, I've noticed over time, going back to the folks who get abused, sometimes there's this dynamic that emerges, that there's this less than, and really with the people who are abused, oftentimes there's this lack of identity. I don't know who I am. In other words, they become so enmeshed in this other relationship and trying to make this other person happy, that becomes their identity. And therefore, when they break it off, if they don't get killed, if they don't get severely injured, then there's this, who am I? I have no clue who I am. And then therefore they gravitate to another person who exhibits those same domineering and overly assertive characteristics, those personality traits. So how do you treat those personality traits? Well, there's a DBT, dialectic behavioral therapy, that has been shown to be somewhat effective in reaching people with personality disorders, DBT. One of the problems is this, personality by definition is ongoing and durable. And so treating abusers is very difficult. Oftentimes they adopt this role, and they become accustomed to it over time, and it's oftentimes deeply seated in their earliest upbringing, and even before they can even possibly go back and remember in therapy, these insecurities. But giving up power, giving up control, equality in relationships, giving each partner the equal say in making financial, big decisions in a person's life. That's a really big thing with, as a society, males earn more than females. I think it's $1 for every 75 cents that a female earns, if that. So a lot of times this is ingrained in our social fabric, and so it's difficult to treat. I'll say that much. But anyway, I think this is a overlooked issue. I think that for each person, unless you've really taken the time to work with people that have been in IPV, intimate partner violent relationships, you may think that you understand from looking in on the outside, but until you delve in and really work through this, it becomes much more complex. I will say that this has been a part of my addiction treatment since I began. When I worked at 12 and 12 in 2001, 2002, the adult rehab, I was in charge of two different educational groups. So I'd present to 100, 120 people that are in this rehab, once a month on these topics. One of the topics was multicultural issues, and I actually had a co-instructor, a young woman of color, would help me discuss the implications, and I think that's pretty hypocritical for a white male to go and talk about multicultural issues to a very diverse crowd. So I was honored that this young lady who would help me present every month on multicultural. But secondly, I did have the group on codependency, and so codependency, you often find domestic violence in codependent relationships, and there's a lot enmeshed there with the addiction to substances, the addiction to the relationship, possibly that power and control situation. So it's very complex. I would encourage you to kind of think about the issues that I brought up. I'm sorry I didn't give a PowerPoint. I don't want to go on too much farther in the week, and I've got a busy week here, even though it's for the 4th. So I want to make sure I put something out there for us to think about, and please, take notes. Hopefully you'll take some notes as you go through this. I'll give you some resources. This is an area of passion for me. There's a whole other topic on children who survive domestic violence as children and grow up, from their parents and then grow up into adulthood. So there's some interesting dynamics that emerge there too that we won't go into. But just be aware of some of the issues that I brought up. Be aware of the multicultural discussion that we had when we began this. If you have any questions, please feel free to email me over the week. I'll try to check them periodically. Otherwise, I will see you on the discussion board, and look forward to hearing your thoughts on our topic for this week. Take care.